Of struts from an inferior vena cava filter. Definition: Embolization: a process that uses particularly shoots acts, time healing strokes or veins to block and blood balances. Embology might be used to stop bleeding or to block to flow of blood to tumor and abdomen area of used. Inferior vena cava failure is a type of vascular failure and medical devices that implement by intervention radialis or vascular surgeons into the inferior vena cava to presumably prevent life-threatening pulmonary and embolism.
Embolization is the technique of blocking abnormal blood vessels. There are several ways to block a vessel. We could use particles, liquid agents like glues, or special coils. Embolization is indicated to block a vessel that is bleeding after maybe an accident. It could be used to reduce the blood supply of a tumor before surgery. It also finds use in the treatment of abnormal clusters of blood vessels. For example, in a case that is bleeding from the intestine, a tube is first taken from a puncture made in a blood vessel of the leg into the blood vessel close to the point that is bleeding. This is done under image guidance. Then through this we pass another smaller tube so that we can reach the very site that is bleeding. Then we use multiple platinum coils to block the vessel, curing the patient or stabilizing the patient completely. Embolization is a revolutionary technique which can be life-saving in several situations. It is performed under local anesthesia and often the patient can be discharged in a day or two.
Pros and cons. Pros can be left and high risk PA wide contractures of anticoagulation. Cons increased risk of sugar DVT, filters migration, evolution, and EBC stoutness or conclusion.
IVC filters are medical devices that are intended to help people with blood clots. They're inserted into the biggest vein in the body and they're designed to catch blood clots that come from the lower extremities before they can travel to the heart, or the lungs, or the brain. back in the early 2000s, two companies, Cook and Bard, started to heavily advertise what they called retrievable IVC filters. These were filters that doctors thought that they could put in and then go back in whenever it was appropriate to take them out. The problem is that the companies didn't inform the doctors how long it was safe to leave the filters in the patient's body. And after only a matter of weeks, the tissue and the vein would grow around the legs of the filter and make it impossible to remove it. The filter had become embedded and couldn't come out even if the doctor wanted to take it. People are having strokes, people are having bleeding complications, people are dying because of these defective filters. The scariest thing about this is that one of the companies, Bard, actually knew about this problem, but hadn't warned the public and hadn't told the doctors about what to expect. The stakes for these companies are very high, and they're pulling out all the stops to defend these cases. Our firm has experience handling medical device litigation, product liability litigation, personal injury litigation, and we combine all that experience together to help folks who are experiencing these problems. If you have an IVC filter and it hasn't been removed, you should see your doctor right away. Some doctors are ordering x-rays to evaluate whether the filter has moved or whether it's stuck and can't be taken out. If you've experienced any problems from an IVC filter, or you have an IVC filter and you're not sure whether it's a defective Bard or Cook product, please call us. We'll be happy to talk to you.
Application in medicine. EVC filter. There are two general types of EVC filter colored. Embolization intake units stay permanent and opposites are retarded. Permanent filters have been used side and are placed and passes. Why it allowed named for mentalists, police, and guys PE and isolate controlation to anticoagulation. Opinions filters have been abolished since late and are destined to be retrieved or placed after two temporary drugs of PE or contraction to anticoagulation has resolved.
So RMD, today we'll be talking about IVC filters. Got an IVC filter right here, and we're going to talk about them. Now, I'm not going to get into a discussion on whether they work, whether they don't work, whether they really prevent PE, or whether they prevent mortality. Lots been written about that. I really just want you guys to visually see an IVC filter and try to understand it. This is the device. This is it. That's the device. If you're looking up at it, that might be the last thing that a clot sees before it's hopefully captured by this device. So you can actually see there's these kind of more straight struts there. Those are supposed to be the four struts that are used to anchor the device into the IVC. You have these more curved struts there, and those are set to kind of center the device, of course, capture throw. If you look there, you can see on the top of the device, so the top of the device, the apex of the device, has a hook on it. Use that hook to take the device out of the body. So what does this device feel like? Well, it has these little hooks, like I said. Those hooks actually kind of hook into tissue. You can actually feel it kind of hooking into the skin. You can see how it sort of catches on the skin. So you can see how it will catch the inside of the IVC. This device is it's sturdy, but it's not completely stiff. You can see it bends a little. It's meant to sort of collapse the device a little bit. And it comes in the kit. It comes collapsed. So that's how the device is. That's an IVC filter. I said in the beginning, I really don't want to discuss this more than just show you what it is. Would this device capture clots? Could this prevent a pulmonary embolism? I think it does. I think it will. Ultimately, you have to believe it yourself. Do you believe this device can save lives and capture them? Alright guys, that's it. I just wanted to show you the IBC filter. Please click like below if you like this video, or subscribe for additional content. It's from RB. See you guys.
Use in Ecuador. In Ecuador, there is a medical center specialization and cardiology problems called Cambury Cardiovascular Institute, where they perform this type of producer EBC filter. Has new devices have become available, clinicians have become more familiar and conformed with EBC filters.
OHSU Department of Interventional Radiology. IVC filter placement.
Before the procedure, you will be taken back to the angiography room by our staff, which will look similar to the operating room. Once in the room, our team will do a team pause, where you will be asked your name, your date of birth, the last time you ate, and any allergies you have. You will also then switch beds with the help of our team. At this time, either an area of your upper thigh or neck will be prepped for the procedure, which includes sterilizing the area with soap and covering the rest of the body with a large blue sterile sheet. To identify the area to be prepped, the doctor will feel your pulse and use ultrasound to confirm the accessibility of your vessels for the procedure. You will be asked to keep your arms by your side and remain still throughout the procedure. Your nurse will check in with you regularly to ensure you are comfortable. The doctor will start by using a small needle with numbing medicine to numb the area of skin that will be used as an access point to the blood vessels. You will initially feel a cooling and numbing sensation followed by pressure. The doctor will then use another needle to access the blood vessel with the easiest path to the IVC, where they will deploy the filter. Once the needle is inside the blood vessel, a very thin wire is inserted into the needle, which will then be used to guide the catheters or thin, long tubed instruments into the system. The X-ray machine will be used at this point to ensure proper placement of the wire. You may feel the bed or hear the machine move around you. Your doctor is controlling all of the movements. At various points during the procedure, the doctor will inject contrast and take images of your blood vessels to document that they are in the correct position. Once the doctor successfully advances the wire to the IVC, they will then advance the filter and deployment device over the wire. This may require some additional opening of the access site with a dilator. Again, the only sensation that you should feel at this time is pressure. Once the device is at the IVC, the doctor will deploy the filter. They will take another image to ensure its proper placement. Following this, the doctor will end the procedure by removing the wire and catheter from the access site. Your doctor will then hold pressure on the access site for 10 to 15 minutes to ensure proper clot formation. Your nurse will then wheel you on your bed to the PCU or the procedural care unit to be monitored before discharge. Once it is time to remove your filter, you will be brought back into the angiography suite for a removal procedure. Most of the steps are identical to the initial procedure, however the access site will most likely be through the neck. hope this video has been informative. If you have any further questions or concerns, please don't hesitate to ask.
Conclusion. As new developments have become Abelling and cleanings have become for familiar and conformant, while IBC filters the indication for final cleanses have continued to evolve and expand.